Have you ever been told to get a vaccine, but no one explained why or if it's even safe, especially during pregnancy? Today, we're diving deep into a question many expectant parents are quietly asking: which vaccines are truly safe during pregnancy, and which should I stay far away from? So if you're expecting, or just preparing wisely, stick with me. Hi, and welcome to Clarivive MedInsight, where we simplify women's health. Why vaccines matter in pregnancy. Your immune system changes during pregnancy. You're more vulnerable to certain infections, and so is your baby. But here's the amazing part. When you're vaccinated, you pass protective antibodies to your baby. That means your baby is born with some level of defense, especially during those first few fragile months when they can't be vaccinated themselves. Vaccines during pregnancy are about prevention, protection, and peace of mind for both of you. Let's start with the ones you should definitely take. 1. Tdap vaccine, tetanus, diphtheria, pertussis. This is one of the most important. Given between 27 and 36 weeks, ideally during each pregnancy, regardless of your previous vaccine history. It protects your baby from whooping cough, pertussis, which can be deadly in infants. 2. Influenza, flu, vaccine safe in any trimester. Flu during pregnancy can cause severe complications, including hospitalization and preterm birth. The vaccine protects both you and your baby. 3. COVID-19 vaccine recommended during pregnancy by major health organizations. Can be taken in any trimester. Reduces risk of severe illness and complications from COVID. 4. Tetanus vaccine. Where Tdap is not available, 2 doses of tetanus vaccine may be given instead. Helps prevent neonatal tetanus. Still a risk in certain regions. Now let's talk about conditional vaccines, the ones that might be given if you're at risk. 1. Hepatitis B vaccine. Given if you're at high risk or test positive for hepatitis B surface antigen. Can be safely administered during pregnancy. 2. Hepatitis A vaccine. May be given if there's risk of exposure, such as during travel or an outbreak. Considered safe in pregnancy, though more data is still being collected. 3. Pneumococcal vaccine may be considered in women with chronic conditions like asthma, diabetes, or immune disorders. 4. Meningococcal vaccine. Given only if there's a high risk, such as travel to outbreak areas or exposure. 5. Rabies vaccine. If you've been bitten or exposed, rabies is fatal, and the vaccine is safe in pregnancy when needed. Some vaccines are live attenuated, which means they use a weakened version of the virus, and these should generally be avoided. On MMR, measles, mumps, rubella. Not recommended during pregnancy. Get this at least 1 month before conception if needed. Varicella, chickenpox. Another live vaccine to avoid during pregnancy. Plan it in your pre-pregnancy care. 3. HPV, human papillomavirus. Not recommended once you're pregnant. Can be resumed after delivery. 4. Live influenza nasal spray, LAIV. Not safe. Only the injectable flu shot should be used in pregnancy. Here's a quick overview of when to get what. 1. Tdap, 27 to 36 weeks every pregnancy. 2. Flu shot, any trimester. 3. COVID-19. Any trimester as advised by your doctor. 4. Tetanus only, in place of Tdap, depending on local healthcare policy. 5. Others, Hep A, B, rabies, meningitis, etc. Only if you're at high risk. Talk to your healthcare provider early in pregnancy, or ideally before you conceive, to build a personalized vaccine plan. Let's wrap up. Are vaccines dangerous during pregnancy? No. Vaccines like Tdap, flu, and COVID have long safety records and are non-live. Will vaccines harm my baby? On the contrary, they protect your baby in their most vulnerable weeks. What side effects should I expect? Sore arm, mild fever, fatigue, all normal. Serious reactions are rare. Vaccines don't just protect you. They create a safety net for your baby before they even take their first breath. Stay informed and talk to your doctor. And let's keep you and your little one safe and strong. In our next video, we're talking about asthma during pregnancy. What's safe, what's not, and how to breathe easier, literally and medically. Don't miss it. Don't forget to like, subscribe, and join us next time here at Clarivive MedInsight, where you learn differently. Thanks for watching.